I'm representing the business sector. I can't tell you my remarks would be as compelling as the wonderful speakers from the civil society delegation who are here today, but they're important nonetheless. As a leader in BD, a global company extensively involved in HIV/AIDS and TB, let me mention how important it is for the entire business sector to be included as an equal partner in the global response to these diseases. We need to ensure that public-private partnerships are created, funded, and monitored effectively. Companies have access to workforces, families, and communities throughout the world, which can help enable health plans and policies to be implemented that are complementary to the efforts of government and non-government organizations. Many companies have already implemented non-discrimination policies specifying that HIV status cannot be utilized as a basis of employment, promotion, or retention. This is the fundamental starting point for corporate involvement in HIV/AIDS and AIDS. Further, these policies often stipulate the provision of specific healthcare services, including prevention, DCT, and antiretroviral treatment. These benefits are often extended to families, and some companies have expanded their outreach to surrounding communities. There is still much more progress to be made, particularly among employers in the informal sector and migrant workers. Public-private partnerships are critical in linking employees, their dependents, and community members to health services and ensuring the services received are of a high standard. Beyond workforce policies, the application of core competencies represents an even broader opportunity for business sector engagement. One method is to create access to appropriate technology. An example is public-private collaboration to advance diagnostic technology for BD, including tests for drug-resistant strains to address HIV and TB co-infection. Another important intervention is to provide technical assistance to strengthen local capacities. Some companies have deployed trainers in developing countries in partnership with country health ministries and international agencies. An example is training to improve laboratory worker skills to perform diagnostic tests for HIV/AIDS and TB. This has been deployed in 58 developing countries. Philanthropic funding represents a further opportunity for business sectors involved in core issues impacting HIV/AIDS. One example is funding and technical support to provide HIV prevention and treatment services to health workers who themselves are at high risk of disease transmission, and that purpose demonstrates the ability to achieve the goal of universal access. Companies can also deploy volunteer programs that provide their most precious resource, their people, by sending volunteer teams to strengthen health services aspects for people living in rural districts and villages in poorly resourced countries. When the skills and resources of companies are fully harnessed, the business sector can have significant impact in helping address the world's most pressing issues, such as HIV/AIDS and TB. I've provided actual examples of our experiences in the healthcare industry. Similarly, companies in other industries have demonstrated very positive contributions in areas such as financing, IT, media, communications, and surveillance systems. As a business leader and a member of civil society, it is a privilege to be able to contribute in this manner, but also to stress that it is incumbent upon us to do much more. Thank you.